My name is Emma Barlow and I am a Policy Advisor in the Tackling Loneliness team within the UK Government's Department of Digital, Culture, Media and Sport. Thank you for the invite to join in the discussion about addressing loneliness from governmental perspectives. We are so pleased that the event is taking place and that there is a growing interest from governments across the globe in the area of tackling loneliness. Since the UK government appointed the world's first minister responsible for tackling loneliness in January 2018, people from across the country and the world have come forward to share their experiences and knowledge of loneliness and to learn from our approach. The UK government's Tackling Loneliness strategy sets out a clear vision for the UK to be a place where we can all have strong social relationships, where families, friends and communities support each other, especially at vulnerable points when people are at greater risk of loneliness. Where institutions, businesses and organisations value the human element in their interactions with people, and where loneliness is recognised and acted on without stigma or shame, so that we all look out for one another. In 2016, a cross-party loneliness commission was set up by the MP Jo Cox. The commission ran for 1 year and worked alongside charities, businesses and the government to understand the problem of loneliness in the UK and what role the government could play to reduce it. This work culminated in the publication of the report Combating Loneliness, One Conversation at a Time at the end of 2017. The report called for national leadership, a national indicator, innovation fund and clear areas of responsibility for local government, businesses, communities and individuals. In 2018, in response to the Jo Cox Commission report on loneliness, the government set out its first steps to tackle loneliness. Over the course of 2018, the government appointed the world's first minister to lead on the work of tackling loneliness, launched the £11.5 million Building Connections Fund in partnership with two British funding organisations, the National Lottery Community Fund and the Co-op Foundation. They developed a recommended measurement package, started to improve the evidence base on loneliness and published the world's first government loneliness strategy. The UK government recognises that loneliness is a pressing public health issue, with 6% of adults in England considered chronically lonely. Loneliness is linked to early deaths, on a par with issues like smoking and obesity. We know the negative impact that loneliness can have on a whole host of aspects of our lives, including our health, well-being, productivity and self-esteem. Feeling lonely often or always has been linked to early deaths and an increased risk of coronary heart disease, stroke, depression, cognitive decline and Alzheimer's. We strongly believe that governments have a part to play in reducing loneliness. The government's work to understand more about who is impacted by loneliness in England has found that some groups are at an increased risk of loneliness, including young people aged 16 to 24, people with a disability or long-term health condition, and people who lived in the most deprived parts of the country, as well as those who live alone. The government has recently released research into the connection between mental health and loneliness across different life stages. For those in the middle age group, that means those 45 to 60 years old, and the retirement group, those who are over 60, there were a number of overlaps in the types of experience or events that led to loneliness. A decline in physical health was associated with increased feelings of loneliness and a deterioration in mental health. People in those age groups experiencing chronic pain or mobility issues were sometimes no longer able to participate in social activities. Changes to their work routine, whether redundancy, increased home working or retirement, could also trigger feelings of loneliness where regular social contact with work colleagues was lost. And finally, experiences of bereavement became more frequent as people aged, and this triggered feelings of loneliness, particularly after the loss of a partner or close family member. In 2019 and 2020, the overall proportion of adults in England reporting that they felt lonely often or always was 6%. We have continued to measure levels of loneliness amongst adults over 16 in England, and findings from the 2020-2021 Community Life Survey found similar levels of chronic loneliness as pre-COVID. The UK's Tackling Loneliness strategy recognises the impact that loneliness has on people's health and well-being, and sets out a clear vision for this country to be a place where we can all have strong social connections and relationships. The 3 pillars of the government strategy are reducing the stigma, driving a lasting shift, and building the evidence base. Reducing stigma by building a national conversation on loneliness so that people feel able to talk about loneliness and reach out for help. Anyone can feel lonely, but it isn't always easy to admit that. The original strategy committed to delivering a national conversation to reduce the stigma that can make people feel ashamed to admit they feel lonely. We launched our first campaign in 2019 and have continued to deliver communications activity encouraging people to talk openly about loneliness and take small steps to help themselves and others ever since. This year, we combined our loneliness campaign with the UK's National Health Service flagship mental health campaign, which shares advice to help people look after their mental health and well-being. By doing this, we want to reach more people and support them to think about how having good social relationships can help their mental health and well-being. In January of this year, we launched a new campaign phase that focused on encouraging young people aged 18 to 24 to lift someone out of loneliness by carrying out small acts of kindness to help someone else who may be feeling lonely. This year, during 2 important awareness weeks in the UK that are run by charities, Mental Health Awareness Week in May and Loneliness Awareness Week in June, the campaign to reduce stigma around loneliness reached millions of people. The theme of Mental Health Awareness Week this year was loneliness, and the Duke and Duchess of Cambridge helped to shine a light on this issue by broadcasting a message of support across over 500 UK radio stations simultaneously. During Loneliness Awareness Week in 2021, with help from partners including TikTok and EA Games, we reached millions of people with our Reducing Stigma campaign and saw over a 1,000% increase in visits to the campaign website compared to the previous week in May. The second pillar of the government's Tackling Loneliness strategy is driving a lasting shift. We want to drive a lasting shift so that relationships and loneliness are considered in government policy making, both so that government action has a direct impact, but more importantly, to support and amplify the impact of civil society organisations who are connecting people in their communities. We know that work to tackle loneliness is best done in partnership. We are working across government departments and across charity, public and private sectors to support action at a national and local level. The Tackling Loneliness Network was formed as part of the government's plan to tackle loneliness during coronavirus and brings together almost 150 organisations across the public, private and charity sectors. The scale and diversity of the network's membership reflects the government's ambitious approach to tackling loneliness and our commitment to finding innovative ways to engage organisations and individuals from all areas of society. The network published an action plan in May 2021, focusing on initiatives where the government and network members can have an immediate impact as part of supporting a connected recovery from COVID-19. we provided an update on the commitments outlined in the action plan in our 2022 annual report. In 2021, we also launched the Tackling Loneliness Hub, a digital community for network members to connect with others who are also working to reduce loneliness and share the latest research, insights, and attend events. There are currently nearly 300 members in varied roles, including frontline delivery professionals, national policy advisors, academic researchers, those who work for corporations, and those who work at local authorities. Whilst the Department for Culture, Digital, Culture, Media and Sport leads on the cross-government Tackling Loneliness strategy, we recognise the importance of multiple government departments contributing to this work. A ministerial group was set up in 2018 to oversee delivery of the 2018 strategy, which contained 60 commitments from departments across government. Many of these commitments have now been fulfilled, and the work of tackling loneliness continues to be embedded across the government's work. Examples of this include the government's commitment to provide concessionary travel to nearly 10 million older adults and disabled people. To further support this, the Department for Transport has an inclusive transport strategy that sets out how the government will make the transport network more inclusive and accessible, particularly for older adults and disabled people. Key recent highlights also include working with the Department for Health and Social Care on the expansion of social prescribing, the Department for Transport on a Tackling Loneliness Fund with Transport Fund to support 12 organisations with pilot projects exploring how transport provision can help to reduce loneliness, and with the Department for Education to include loneliness on the national curriculum. We are proud to be the first country in the world to launch a Tackling Loneliness strategy and to share our learnings with other governments who are also taking action to reduce loneliness in their countries. We have recently met with delegations from Japan, Denmark, and the United States of America. The third key part of the strategy includes playing our part in improving the evidence base on loneliness, making a compelling case for action, and ensuring everyone has the information they need to make informed decisions on what to do to tackle loneliness. As part of this, the government commissions and shares research. Some of the research papers published recently include one investigating the factors that are associated with loneliness in adults in England. This used 2 England-wide surveys to learn more about what demographics and life circumstances are strongly associated with experiencing loneliness. Another research paper we have recently published looks at the relationship between mental health and loneliness. The research segmented people into 4 age groups with specific findings for over 60s reported as part of that. Along with funding and commissioning our own research, we regularly convene an evidence group, a group of academics and researchers who are interested in researching loneliness, to identify what we still need to know about loneliness and how to start addressing those evidence gaps. In January 2022, this group of researchers published a review about the current gaps in evidence and made clear recommendations about the future direction of government research. This report is informing the government's approach to commissioning new loneliness research. The Office of National Statistics has also developed a methodology for measuring loneliness. The government now uses this as its standard way of measuring loneliness, and the measures are included in 13 government surveys. This helps us to keep track of national trends and changes in the population's experience of loneliness. COVID-19 highlighted the importance of social connection and showed many people how difficult it can be when you feel isolated. During COVID-19 pandemic, the government took action and provided emergency support measures, including grants to charities to help them continue to help people connect with each other during the pandemic. In total, Over the course of the pandemic, we provided over £34 million of support to charities to help them reduce loneliness, with an additional £50 million of funding going to organisations who are supporting people with their mental health. Through our COVID-19 loneliness funding, in addition to groups including carers, those with disabilities and people with a mental health condition, we supported groups that work with older people to help them connect. Last year, members of our Tackling Loneliness network formed a task and finish group focused on older people's loneliness to explore this issue further, with the group's recommendations included as part of the Tackling Loneliness Network Action Plan. An update on progress to deliver the action plan was included in our 2022 annual report. Well, what's next for the UK in our quest to reduce loneliness across our population? We're continuing to deliver on the 3 main points of our strategy. As we continue to try and combat the stigma around loneliness, we are planning for a 3-year national comms campaign, building on the learnings from our most recent campaign to develop a robust strategic direction to ensure we can reach our audience in a creative, engaging and effective ways. We are continuing to drive a lasting shift by growing those engaged in the Tackling Loneliness Network and those who have access to the Tackling Loneliness Hub. We also continue to engage with government departments across the government to ensure that tackling loneliness remains high on their agenda. We are also continuing to build the evidence base by commissioning research to understand more about loneliness and what works to help people overcome it. We will also continue to deliver pilot programs that will help us understand how we can reduce loneliness in the most deprived areas of the UK.